Hello, I'm urologist Omer Erdamakaya. Today we'll have a short video presentation about erectile dysfunction and Proviron treatment. Proviron is a synthetic substance developed in 1935 and still used today, which is in the dihydrotestosterone group and has anabolic and androgenic effects. It's frequently used in urology for loss of sex drive and erectile dysfunction, even though it is not the top treatment option for those. If we check Proviron's hormonal effects, it has unique features that distinguishes it from other anabolic substances. What are these? It doesn't make the testicles smaller. Because it has no impacts on LH. It doesn't cause gynecomastia because it doesn't aromatize into estrogen. Unlike other orally taken anabolic substances, it is not toxic to the liver. Those have three main features. And another reason why it became popular is it directly binds to the protein sex hormone binding globulin, which directly affects whether testosterone is active or passive in the blood and makes testosterone passive when binding. It binds to it more than testosterone and even DHT. So that increases free testosterone amount in the blood. And when it's used along with other anabolic substances, it increases their effectivity and functions. It decreases the level of estrogen. It's believed in the anabolic world that it has an aromatase inhibitor effect, but there is no such study to prove it. But we see that it decreases sex hormone binding globulin and estrogen levels in long-term use. What are the other side effects? Its biggest side effect is to cholesterol metabolism. It increases bad cholesterol and decreases good cholesterol. It increases the risk of cardiovascular diseases. Also contributes seriously to genetic hair loss. Because it is in the dihydrotestosterone group itself. It can't be metabolized with substances like 5-alpha reductase inhibitors. It means that you can't decrease Proviron's effect when you use Avodart. Apart from all, IC informs that it's used in PCT periods. It doesn't rehabilitate testicles while in PCT periods because it doesn't have an LH effect, but Proviron even used as antidepressants in the past. Maybe it can be helpful as an antidepressant while in the PCT period. Or maybe the patient benefits from it if he has a loss of sex drive or erectile dysfunction. But since it's like fixing the effect of one anabolic with the other, so it doesn't seem right. Apart from that, there is a study conducted in our country in 2014. In that study, 50 mg doses of Proviron per day were used for 2 months by patients with light prostatism problems, loss of sex drive and erectile dysfunction. It was observed in the study that estrogen and sex hormone binding globulin decreased, and it didn't have a serious side effect on testosterone, FSH or LH, and it helped to decrease complaints of the patient seriously. As a result, Proviron is an old and safe anabolic and used frequently in urology. But I never recommend its use without a doctor's control. In fact, this video is an informative video and not intended for any treatment. Thank you for listening, best regards.